Good morning. At the outset, I want to thank Dr. Kakakar and the organizing group for having me here. My brief today is for the examination of the foot and ankle. After a very exhaustive talk on the examination of the hip, the most important case that we can get in the exams, now we move on to the foot and ankle. Usually in the exams, the commonest foot and ankle problems we generally tend to give a candidate is neglected CTV, which is very common, the tendo-Achilles ruptures, and hallux valgus, pes planus, trophic ulcers, foot drops. These are some of the common cases that, as a foot and ankle cases that you may get in the surgical. Well, the relevant anatomy, the foot is divided into three parts: the rear, middle, and the forefoot. As you all know, the rear foot is formed by the talus and the calcaneum, the midfoot, navicular cuboid, and the three cuneiforms, and the rest of the 14 toes, the bones of the toes, and the metatarsals form the forefoot. The ankle joint, a hinge joint, which is articulating with the dome of the talus. The talus is the most important bone because it's the connector between the lower leg and the foot, and it tends to take more weight than any other bone in the body. The lateral ligament complex, you all know the anterior talofibular, the posterior talofibular, and the calcaneofibular ligaments. There has a very large ligament complex around the ankle because the muscles around the ankle are not very strong and do not hold them very stably. The syndesmotic structures, the anterior and posterior inferior tibiofibular ligaments, the transverse tibiofibular ligament, and the interosseous membrane forms one of the for the stability. The medial structures, medial ankle structures, the deltoid ligament on the medial side is one of the most strongest ligaments, and it forms the tibiocalcaneal, the tibionavicular, and the anteriotibial part, and the other ligaments on the medial side. This is a relevant anatomy of the structures around the ankle. So you will see what all structures anteriorly, laterally, posteromedially, you will have to check on these while examining a foot and ankle case. Well, as it is always, the history is one of the most important thing. So what if the patient's symptom is the pain? Pain is the most important symptom for that particular patient. So you will have to ask about the duration, site, is there any radiation, is it coming from the lower leg, what are the aggravating factors and the relieving factors, and are there any variations during the day, and any acute injury or chronic injury. If the patient's chief symptom is a swelling, again you will have to look at the duration, how and when it started, how was it, whether it is progressing, is the static, and has the swelling decreased over a period of time, and how does it relieve. These are some of the, when the patient's main symptom is swelling. If it is limp, then you talk about the onset, the duration, whether it is painful or painless, and whether the limp is progressive. Again, another symptom which the patient can have is an instability, particularly in cases of the post-polio cases. You can find out when it came up, what's the duration, whether there has been any trauma, whether there has been diagnosed for any ligamentous injury of the ankle, and whether the instability is while walking on an uneven surface. That will give you initial. When the chief complaint is the deformity, whether the onset was at birth, and whether this thing was preceded by any fever or any other myalgia and weakness. And Now, it's also in the history taking, you have to find out how he is ambulating now. That's important. Were there any previous injuries? Was any surgery done? Any past medical history? Has there been any evidence of rheumatoid arthritis or any any evidence of gout in his history? We'll have to assess and take it into consideration. So these are some of the, with the histories, these are some of the conditions which you can get. I have tabulated them, probably you're not able to see them very well from there. So an overview, 3 things to remember in patient's gait, footwear, and the foot and ankle have to be examined. I put the footwear examination initially because you will get to know as the patient is walking in, you will know where the wear of the footwear is. If it is normally, it's the posterolateral wear. If the varus is of the hind foot is there, then the excessive lateral wear occurs. If there is a valgus heel, then you tend to have an abnormal medial wear. So we will discuss this in the present steps, like the consent till the special tests. So the prerequisites, beyond the table, exposure from the lumbar spine to the tip of the toes, and examine the patient in gait, standing, non-weight bearing, and sitting. Gait analysis has been talked about both in the hip joint examination, and Dr. Matthew yesterday was talking about the examination of the gait. So you will here now think about the stride length, whether it's short, whether it has got an antalgic gait, whether the stride length is symmetrical, whether there is an internal or external interning of the toes. We'll have to assess. I will not go into any details on this. But you check on whether the gait is antalgic, whether it is a high stepping gait or a equinus gait. So inspection. In inspection, you have to see how the foot is aligned to the leg and the ankle. The ankle, foot, and the hip, knee, and ankle, and the foot. What alignment they are, and what shape and size. Whether they have any deformities or deviations or any other extra prominences that you can make out. Or skin, there may be a lot of sinuses and scars. When the patient is standing, you have to look at the arches. Is there an in-toeing or out-toeing? Is there a shortening? How are the toes positioned, and the heel, whether the heel is in varus or valgus. And also look at the tendo Achilles. Or when you examine from the back, are there any too many toes sign? In the inspection from the anterior aspect, we look at the alignment of the great toe. Is there any swelling in the great toe? The condition of the skin and the loss of among the toes, look at the loss of the transverse skin creases. Are there any sinuses, paronychia, and other? Anteriorly again, osteophytes, first metatarsal phalangeal joint, hallux valgus, and you look at all the tendons or the anterior aspect of the foot. So inspection, you'll see the hallux valgus deformity, paronychias, mallet toes, hammer toe, or the claw toe, one of the few conditions. These are some of the explanations of how the claw toe, what happens to BIP and the PFP joint and the MTP joint, hammer toe and the mallet toe. Laterally, you look at the lateral malleolus, look for swellings, which are generally the tendo Achilles bursitis, very common. Posteriorly, again, very important, you look at the varus and valgus of the hind foot. But too many toes sign because in a very valgus foot, and you may see more toes from behind. That is called a valgus toe sign. Too many toe sign. Whether the patient can stand up on the toes, how is the arch? So this is a too many toe sign. When the patient has got a deformity like this, you tend to see more than 2 toes from behind when you examine the patient. So 4-foot varus and valgus, when standing, you will have to look at how the position is. This is a windlass test, windlass effect, where once a patient goes on the toes, where there is a dorsiflexion of the great toe, the arch forms because of the tightening of the plantar fascia. So examination from behind again, you will have to look at these deformities. Sometimes they may not be very well seen from the front. So the same patient which I was talking, and from the back there is a deformity which you can see easily. Tear ruptures, unable to stand upon the toes. Medially again, look out for all the bony prominences, the tibialis posterior tendon, whether there is a cavus or a planus or a rocket bottom foot. So plantar wise, you will have to look out for callosities, corns, ulcerations, and warts of the other fungal infections. Inspection from all sides are important because now you're seeing from the posteriorly. Again, this patient, when you see from the front, you tend to see these supernumerary toes. On palpation, there is a local look for the temperature, swelling, and look for the very important the tinal sign of the deep peroneal nerve. Laterally, again, you will have to look out for the peroneal tendons, severs, the calcaneum tuberosities, sinus tarsi, and the fibular shaft. Posteriorly, you will look for the gastrosoleus tear ruptures, the Haglund's deformity, the swelling on the attachments of the medially, the medial malleolus, the head of the talus, navicular tuberosity, all any deformities or disabilities or prominences has to be recorded. On the plantar aspect, you will see the callosities, sesamoid bones, and the plantar fascia. The range of movements of the ankle have to be measured both as active and passive. 4-foot passive position with the 4-foot in inversion and the hind foot neutral. So you have to check the range of movements. If an equinus deformity, assess the passive dorsiflexion with both knee flexed and extended, which is the Silver-Squat test. The subtalar joint, you will have to stabilize. One hand stabilizes the talus, the other hand moves the calcaneum, and you will see the range of movements of the subtalar joint. 4-foot movements, very small jog of movements, maybe a 5 to 10 degrees of 4-foot movements occurs. Toes movements, the MCP joint flexes to about 45 degrees and the IP joints a little more. So neurovascular assessment in all this, your motor, sensory, and also the vascular status has to be assessed. Muscles to be tested are the ankle plantar flexors by toe walking, ankle dorsiflexors by the heel walking, everters walking on the medial border, and the inverters walking on the lateral border. These have to be checked and recorded and not. And so the dorsiflexors have L4, L5 root value. You are checking on the tibialis anterior, the extensor hallucis, and the extensor digitorum. Plantar flexors, L5, tibialis posterior, flexor digitorum longus, and also the peroneal muscles which also form. So you have to do a good neurovascular or muscular strength assessment on all these patients. Everters of the foot, peroneal brevis, assisted by the peroneal longus. To test eversion, place the patient's foot in the everted position with the ankle plantar flexed. So we're testing the tibialis anterior. Sensation is a very important part. Sensation testing is a very important part in the foot and ankle because you can find out a lot of problems which come from the spine. So you should know your dermatomes very well. So you have a sensory area, key areas for L4, L5 and S1 in the foot, and it's very helpful in diagnosis some of the back conditions also. Reflexes, we'll have to check the ankle jerk and the plantar reflex. Here and when you're examining the foot, you have a rule of 3. In general, making it very short. Examine the patient in walking, standing and sitting. Palpation, topographical, neurological and vascular. Neurologically, you'll have to check on the sensation, reflex and motor strength. Vascular, manipulate the joints and see if there is any snapping or subluxations of the tendons and examine the footwear. So these are the rule of 3 when you're examining. So this brings about a complete examination of the foot. The special tests for the anterior drawer test, syndesmotic injury and tear rupture. The Thompson test where you do a squeeze test. So you're doing an anterior drawers test to see whether the anterotibiofibular ligament is stable. Look for peroneal tendon instability, rotate the ankle in the maximum dorsiflexion and see if there is any snapping of the peroneal tendons. So syndesmotic injury, you do the squeeze test from the middle 1/3 of the leg, come down, squeeze it, you will see if there is pain around the tibiofibular syndesmosis. And also is the external rotation test, is another test to find out about the syndesmotic injuries. This is a Thompson test to confirm the Achilles tendon rupture. If when the compressing the calf muscle, the foot should go into plantar flexion. In absence of that, we will say that the tear of the a needle test is also described, but which we normally don't do. The special test to determine whether the gastrocnemius or soleus is causing limitation of the ankle dorsiflexion. Sulfur test, we described yesterday very well. The tibialis posterior tendon stability, you do a single heel raise test. That's more common, where the patient cannot have the single heel raise, where the patient is off, the other leg is off the floor, and the patient has to go on a single heel. So he will not be able to go, and the foot will move into valgus. Coleman-Black test is again to find out whether the foot or the calcaneus varus is secondary to any problems in the calcaneum or the first ray. So if the Coleman test, you will put the medial part of the foot on block, allowing the first and the second ray to go into plantar flexion. If the varus corrects, then which means that the calcaneum is flexible, or the rare foot is flexible, and you can probably correct the cavus only by working on the forefoot. Morton's test to detect the interdigital neuromas, the compression test across the metatarsals is Homan's for detection of DVT. So, regaining of the medial arch on dorsiflexion of the great toe, this is what you call a jack test. It's almost like a windlass effect. That's when you're standing on the foot. Flexible flat foot, the arch is obliterated on weight bearing but regains on non-weight bearing. Other joints, spine, hip and knee have to be examined. Conditions of the spine and hip causes a lot of deformity or disabilities in the foot, like a shortening, the patient walking on a, because of the shortening, patient walking with the equinus foot, spine, neurological condition, the spine causing problems with the ankle and foot. So there was an exam where I attended, where one of the examiners asked this question: what is the Ottawa ankle rule for radiography? Because I had never read it, and then afterwards I went and found out. Ankle X-ray series to be ordered when a patient had bone tenderness in the posterior edge or tip of the lateral malleolus, posterior edge or tip of the medial malleolus, base of the fifth metatarsal or the navicular. When the patient could not bear weight immediately after the injury and during the examinations. So this is what he asked for, a Ottawa ankle rule. Probably will do well to find out again and go through that. Another is the Bernese ankle rules for X-ray. Ankle X-ray series ordered when patients had pain with any of the following conditions: indirect fibular stress applied by compressing the tibia and fibula, direct medial malleolus stress with the examiner's thumb, and compression of the midfoot. I had made a small additional listing on the CTV, probably not required because already it has been discussed in detail yesterday of the ankle. So, thank you. The foot and ankle.
Faculty members and all the students who have come from all over the country. It gives me immense pleasure and enthusiasm to see such an overwhelming response to joints. I'd like to inform you that we have already crossed the 225 mark of registration. Joints, which was started 17 years back, has always been committed to provide a platform to students to prepare themselves for the exams and for their future careers. We still stand by the same commitment. Joints is jointly organized by Dr. Zog Hospital, Pune, Dr. Kakar Hospital, Nashik, and Dr. Vasantrao Power Medical College, Nashik. Dr. Kakar Hospital is a recognized postgraduate training institute which has 4 CPSD ortho seats each year. Dr. Vasantrao Power Medical College is recognized for MBBS and various PG seats, including D ortho and MS ortho. I would now like Dr. Kakar to welcome our chief guest, Dr. Maisekar sir, the Honorable Vice Chancellor of the Maharashtra University of Health Sciences. Dr. Maisekar.
रेकॉर्डिंग नंतर कॅमेरा हातात काढून पुढे जावं लागलं.
I request Dr. Kakar sir to welcome Mrs. Nirmata. The body has more than 300 institutes in Maharashtra. I now ask Dr. Kakar to welcome Dr. Mrunal Patil, the Dean of Dr. Vasantrao Power Medical College. I'd like to welcome Dr. Zog and Mrs. Zog. Dr. Vilas Zog is the brain behind this course. I would also welcome Dr. Pangavani sir, the HOD of Orthopedics Department.
सर 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 इकडे
Dr. Mrs. Mrunal Patil.
सर सर सर
Dr. Mrs. Job is also present here.
मॅडम इकडे
I request Dr. Myself.
सर इकडे सर
I request Mrs. Nilematai Pawar to welcome Dr. Varghese. I request Mrs. Nilematai Pawar to welcome Dr. I request Dr. Mrunal Patil to welcome Dr. Vaseem. I request ask Dr. Kakatkar to felicitate.
सर सर
It was originally started by Dr. Zog in Pune. Today we are lucky to have him here. We would like to felicitate him. Dr. Kakatkar will give a short introduction of Dr. Zog and how the course was started.
Very good morning to everyone, all the dignitaries on the dais, the esteemed faculty who have travelled from different parts of India, and Dr. Mrs. Lu, and all my friends. And it's a great pleasure for me to introduce one of my closest friends, Dr. Vilas Lu. He was born on 17th May 1958. And has a square family. His wife, Dr. Smita, who is a gynecologist, and two children, Kimaya, who is an ophthalmic surgeon practicing in Mumbai, and his son Ashish, who is an orthopedic surgeon in Pittsburgh in USA. He is my schoolmate, my batchmate from MBBS, MS, and during our post-graduation we have stayed as room partners. And we have shared a lot of memories of our student days and our resident days. After doing his graduation and post-graduation from BC Medical College, Pune, he joined the Department of Orthopedics in Sassoon General Hospital and BC Medical College. As a school and college-going student, he was an excellent sportsman and a fast bowler and represented the college as a fast bowler in cricket. He was an excellent actor, acted in many dramas during his school and college days. After passing his MS, he served as a lecturer, reader and associate professor in the Department of Orthopedics in Sassoon General Hospital. He was appointed as a professor and head of the Department of Orthopedics at the age of 35 in Sassoon General Hospital, and he was the youngest HOD ever appointed till then. Then he joined Bharati Vidyapit Medical College as an honorary orthopedic surgeon and worked as a professor and head of the Department of Orthopedics in Bharati Vidyapit Medical College. In 1998, he started his private hospital as Zog Hospital, and this is the present building of Zog Hospital. He became president of the Maharashtra Orthopedic Association in the year 2008, and he has been an undergraduate and postgraduate teacher for many years in Sassoon and Bharati Vidyapit Medical College, and has participated in many PG training programs all over the country. He has delivered many lectures in state and national conferences, and his Zog Hospital got recognized as a PG training institute for diploma in orthopedics and for DMB orthopedics. In fact, we have shared these moments because at the same time, my hospital with a team of Dr. Kanojia, Dr. Bharat Kelkar and Dr. Umesh Kulkarni, we also got recognized as a PG institute at the same time, and we got recognition for the DMB also at the same time. He had special interest in deformity correction surgeries, and he has carried out deformity correction surgeries free of charge for the inmates of Society for the Welfare of Physically Handicapped and Research Center in Vanavli, Pune. He was also as the honorary chairman of the said society for more than 25 years. He was invited by the International Rotary Club to carry out deformity correction surgeries in Uganda, and this is one of his memories from the Uganda camp, where he had gone to do the correction of deformity surgery. These are some of his pictures where he has been with Sir APJ Abdul Kalam in one of the camps in the deformity correction. These are some other camps arranged with the help of Rotary where he was very actively involved. With his passion for teaching in the year 2001, he started these joints. It's a very confusing name. People think that this is something related to the joint replacements, which is one of the popular things in orthopedics today. But the joints means those orthopedic interactive teaching sessions or seminars. That is how the name was derived as joints. And this is one of the first courses which was conducted in the hospital Pune. You can see the students sitting in the balcony of the hospital, and in the central part of the hospital the course has been going on with the on the bed teaching of the student. These are few other pictures of the joints as it started evolving, and this is Professor Hardikar, who is one of our senior teachers from Pune, and Dr. Parag Bhede, who was one of the persons involved in the PG teaching along with Dr. Zog. This is a joints family, his residents and his team members in Pune. This is me with him in one of the joints courses. Well, I have been associated with the joints for all these years. And from 2009 we started arranging this program on alternate years in Pune and Nashik. And last couple of years we have taken over arranging this responsibility in only Nashik. This is the memory of some of the joint courses, the students registering. These are some of the pictures of students presenting cases to the faculty. This is Dr. Thakur, who has written the books on the implants and the X-ray imaging, and this is Dr. Parag Bhede, who was a part of the teaching program. This is one of the pictures from one of the joints courses where you can see Dr. Dhal, Dr. Matthews, myself and Dr. Zog discussing something. This is the number of students sitting in the auditorium. So with these few words, I think we will like to felicitate Dr. Zog today, and I request Dr. Bharat Kelkar to read a citation for him which we have prepared from the joints family.
Short expression of our profound love and respect towards him. The citation reads like this: to serve with love. We express our deep gratitude to our beloved friend who trained generations of orthopedic surgeons, adorning the position of Head of Department of Orthopedic Surgery in BZ Medical College and Bharati Vidyapith. He endeared himself to colleagues and students with his lively and sporting nature. He pioneered joints and intensive training program for exam-going students, an epitome of academic excellence and surgical skill. He rendered signal service in India and abroad, especially correcting orthopedic deformities in poor and needy patients. As a tribute to this fine surgeon, passionate teacher, and generous friend and philanthropist, we conferred his citation with profound love and respect upon Dr. Vilas Prabhakar Zog from Dr. Vijay Kakadkar and Joints family.
Felicitate Dr. Zog.
सर रेडी समोर समोर थँक्यू सर इकडे
I request one of.
It's about more than 10 years that one day when I was conducting my OPD, I got a phone call from Dr. Joe, and he said that he wanted me to be a faculty on the joints program. And since this came out of the blue, and I had no previous knowledge about this course being run, I immediately accepted it. And since that time, I think every joints course I have attended. And thanks to his unstinting efforts and zeal towards education, that this course has grown to the proportion that we are seeing today. When I initially started coming for the course in Pune, the gathering should be around, you can say, between 80 and 100 students. And today I am told that we have crossed the 225 mark. Apart from having seen his zeal for educating young orthopedic surgeon, I also saw a unique characteristic in him, which was that he would be present throughout the proceedings of the course. In spite of the fact that he was a busy private practitioner in Pune, he never missed any session, and he was with us as faculty members throughout the course, which is rare to have been seen in other parts of the country, where also I have the privilege to be on the PG course faculty. He has showered immense love and affection, not only to me, but to my other colleagues which have been coming to this course, Dr. V.K. Gautam, Dr. Matthew, Dr. Wasim, and Dr. Mehtani this time. His hospitality during the courses has been immaculate, and I have had the pleasure of visiting his beautiful farmhouse which he maintained just outside Pune. I only hope that it is still flourishing. I have also seen that he has a philanthropist in him. I was not aware that he has been conducting free programs for the poor and needy for deformity correction, and I'm very glad to bring out this quality in him. And with these words, I wish him all the best, and I wish that he continues this zeal, and he is with us in the future courses also, and I would be very glad to be a part of the Joints family as much as I have been today. Thank you very much.
Of the Educational Hub, Dr. Maheskar sir, Vice Chancellor, MUHS, Dr. Patil Madam, Dean of this Medical College, Dr. Kakatkar, the dignitaries in the audience, and the delegates. It's my pleasure to be with you all for this inaugural function. I attended first inaugural function of the first joints. It was a special occasion for me because we were trying to do something new. And this inaugural function is also of a great significance and importance to me because today Dr. Zog got felicitated. His contribution to the field of education in orthopedics is recognized and appreciated by his near and dear ones. I am very much thankful to Dr. Kakatkar for all that he has done. The presentation he made, giving glimpses of various activities of Dr. Zog, was really interesting, and it highlighted the multifaceted personality of Dr. Zog. I am also thankful to Dr. Dhal for his kind words. And I am more delighted because this felicitation occurred in the presence of Pawar Madam. Madam, you may not be knowing, but late Dr. Vasantrao Pawar was a good friend of Dr. Zog, and hence the delight and happiness. It won't be out of place if I mention a couple of things here. Patil Madam and Pawar Madam. The ambience of this hospital, the campus of this hospital is nice and clean, and I think the credit goes to both of you. Dr. Maheskar sir, your presence will encourage the organizers to organize more such educational activities. Today I remember the days when we were planning for first joints. We were discussing, and Dr. Zog was quite sure about its relevance and the benefit it will incur to the PG students. And when the preparations were going on, the team was confident about its success. And gradually, this event became popular amongst the students, and we started getting registrations, not only from Maharashtra, but from the neighboring states as well. And I think this success is attributed to two things. One is the hard work and sincere efforts put in by the organizers, by the residents, and by the staff of Zog Hospital in organizing joints regularly every year, and secondly and more importantly, by the contribution made by the faculty. Hardcore teachers, dedicated, knowledgeable teachers accepted our invitation, and they participated in the joints program. Very happily and enthusiastically, they interacted with the students, and they dissipated the knowledge without any reservations, without any restrictions, with open hands and open heart. I am grateful to all of them. And who are these people? Dr. Anil Dhar, Dr. Matthew Verghese, Dr. Gautam, Dr. Bhasin, Dr. Kakatkar, Dr. Zog himself, Dr. Arvind Bhave from Pune. As rightly noted by Dr. Kakatkar, I remember Dr. Parag Bhide here. Though he is not amongst us today, his contribution to the joints was remarkable for sure. As a true and thick friend, Dr. Kakatkar took over the responsibility of organizing joints for last so many years. And he is doing a fantastic job. I'm very much proud of him. Today you heard the number of delegates has reached to 225. And more number of faculty members are adding to the list. I met yesterday Dr. Parthasarathi, Dr. Sharma, and many others, Dr. Kerkar of course, Dr. Kanojia, Dr. Mahale. And I'm sure with his team and with all these faculty, he will continue to organize joints even in future. I wish a great success for this academic bonanza joins 2018. And why only joins 2018? I wish him all the best for whatever educational activities he undertakes in future. I wish a very broad future to all of you as orthopedic surgeons. I am thankful to Mrs. Nirupama Kakatkar, better half of Dr. Kakatkar, as she extended great and cordial hospitality to us. I thank you all for patience.
I request Dr. Murad Patel to address the meeting.
Of Dr. Vasantra Power Medical College and Research Center. Very warm welcome to our Vice Chancellor, Maisekar sir, our General Secretary, Madam Nilimate Pawar, Dr. Jog sir, Dr. Kakatkar, Head of Department, Palkavani, all the esteemed faculty with whom I am interacting with since the past, I think 5 or 6 years, year after year, we organize this Joints 2000 teaching program, and the various students that have come from all the medical colleges from all over the country. It's indeed an honor, Madam Jo, for us to host this Joints on such a large scale. Dr. Gulate is also here today. He's adding to the pleasure of the entire function. She writes since an undergraduate. I think each and every medical student must have realized that if it's one faculty which is very impressive and one group of students or residents which are very impressive, it is the orthopedic guys. It's something which keeps your distinct from all of us, and I'm sure most girls mooning all over your lives since your PG days. And I think, but with that comes a little bit of arrogance, which I have noticed as an administrator, because I have to handle residents from various departments, and I think if there are 2 department residents which I feel are born arrogant, it is orthopedics and radiology. I mean, I may be wrong, but this is my general impression that I have. But nonetheless, yes, a very lively crowd and a very happening crowd. And it's nice that we have 225 of you all under one roof. And since we have all of you all, and since the faculty that is there is a faculty which is supposed to be the best of the best in the country, you could call it a request, but while teaching the students on orthopedics proper, or maybe the various exam cases that you all are dealing with, the short cases, long cases, whatever, I would appreciate, or I would rather be obliged if you could touch a little upon a multidisciplinary approach. Because over the years we have realized, Dr. Satyen is here with us, that somehow it happens that the focus is so much on the orthopedic problem that by the end of the day, or maybe by the end of the week, especially where old cases or senile patients are concerned, probably the medical aspect is missed. And so often we have realized that we have lost patients not due to the orthopedic problem per se, but because the resident, did not pay attention to the vital parameters, maybe the renal function test or various other aspects which go into making of a patient especially when he is of an old age. And not only that, but he is there with the department since the past 3 or 4 days. And suddenly one fine day in the evening, when there is nobody in the hospital except the residents, suddenly the patient has to be shifted from the ward into the ICU because the 3 or 4 days that he was in the ward, the medical conditions were not addressed. So if this could be addressed, or if the importance of this could be emphasized on the residents, probably it would help them in their future practice also. Apart from that, Dr. Kakadkar emphasized on various contributions that Dr. Jog has made to the Society of Orthopedics and Vet Teaching and Orthopedics is concerned. I can assure him, I think, that he is leaving behind a very great legacy because Dr. Kakadkar is there to take over and so also the various faculty members. And as a medical college, sir, I can assure you that we will continue doing the good job that you will be doing. And year after year, it would be a pleasure and an honor to hold this workshop here. Dr. Maisekar, sir, as Vice Chancellor is here. And on 7th of August, I happened to attend a function which was organized by MUHS, where the Chief Minister was the presiding guest, where we had multiple tie-ups, where the university has tied up with multiple universities from all over the world. And one of the sentences that the Chief Minister used was, in his entire tenure as a politician, he has not seen so many MOUs being signed in one single day. So that was, I think, a great achievement of Dr. Maisekar sir. But apart from that, where the multiple tie-ups are concerned, sir, this is one of the platforms where we could invite the foreign universities to tie up with the Orthopedic Society of our college and Dr. Kakadkar and expose the students from outside countries to the orthopedics here and our students to orthopedics out there. So, and again, thanks to Dr. Pangawane and his team, the efforts that they have taken, bring you all together. I think another 1 day of the workshop, and then again we meet after 1 year. So, all the very best for the workshop, and I'm sure the students would be definitely benefiting from the workshop that has been organized on such a grand scale. Thank you.
I request Mrs. Nilimati Pawar to share her valuable
to one and all, dignitaries on the dais and on the dais, today chief guest, our beloved Vice Chancellor, Dr. Maisekar, Dr. Jog, Mrs. Jog, Dr. Kakadkar, Mrs. Kakadkar, our Dean, Dr. Munal Patil, our HOD, Dr. Pangawane, and our ex-HOD, Dr. Pulate, Dr. Ketkar, and all student delegates. I am representing this 104-year-old institution. Our main aim is to run schools in remote area. Our total branches are 487. We are student-centric. If I say about our specialties, we run boat clubs at 3 colleges, one in urban area and 2 at rural area. Our NSS student strength is 4,000. This group is always ready to do anything at any time in disaster. When we means our executive board, have taken charge before 7 years, budget was 400 crore and now it is 649 crore. This Dr. Vasantrao Pawar Medical College is one of our branch. This medical college is also 27-year-old. I know this workshop is initially designed by Dr. Jog. I have seen one lecture and I think you will get small tips from such workshop. As well as this workshop remembered by you for lifetime, which lead which leads students to think, to write and to innovate new ideas. I think from today and onward, this is your, I think this is you have to think, but I suggest you that this workshop should be called Jokes Joint Workshop. You name it this way. This workshop is very useful to every delegate. I congratulate all the organizing team and their vision. I wish you all the success. God bless you.
Chief guest for today, Dr. Maiseka, sir, sharing.
Lemata Pawar, our Dean Gunnar Patil Madam, Dr. Pangavane, Professor of Department of Orthopedics, Dr. Mrs. Jo in the audience, Dr. Mrs. Kakatkar, all the respected dignitaries, faculties from various fields, and all the delegates from all over the country. It's my proud privilege to be present here for this function. Actually, just wanted to share because I was sharing with Dr. Kakatkar in the morning, sir, because sir, this is the workshop which I actually, the joints that were then he explained me in his lecture. And really, I think it is vulnerable that it is for the, exclusively for the exam going students, that's what he told me. All the purposes. See, I had also worked for more than 25 years as a professor in medical college. I also used to arrange this, though I was working in the remote area. But this is actually I will tell you, this is a really renovating knowledge, is a continuing medical education for all you people. And I think definitely it will definitely enrich the knowledge as well as the guidance which has been given by all the senior faculties. Because once you, after becoming a postgraduate, it is very difficult to get all these things. Though you know that now the world is going far out with everything, depends upon the Google, that the advantages are also there, disadvantages are also there. I wanted to share only two things. Dr. Jog sir, I know him very well. Because when I was just newly associate professor, we together were in the Maharashtra Medical Council for 3 years. With Dr. Jog also member and I too was also member. Then madam, I stayed at your residence, you may not recollect, but I know that myself and Dr. Somoshi also, we stayed at your house and we had a nice hospitality. That's my personal moment I want to share here. But as far as the knowledge is concerned, there are a lot of things are going out of the Googles and everything. But I always share, I don't know, I may be wrong or right. But whenever I go to any medical college or any professional college, I have got 346 medical colleges, various faculties colleges under me. Sir, I wanted to share that the using of mobile and advantage and disadvantage also, I think you should also give to your juniors, because what you will follow, that they will follow. Because the recent medical journal, the BMJ has published, has said, is 67% of the professionals, they are suffering with nomophobia, use of mobile and tab, and 65% females they are suffering. And those all are also medical students, among them are the professionals. See, I can share with you that use is okay for the knowledge, but how much is the misuse, that is also because this study has actually carried out use of mobile after 10 p.m. in the night till the morning 6 p.m. It doesn't carry the period which is of the daytime they are using. So my sincere and appeal to you that at least you also look into that, because you are going to the future for the faculty now, because you are going to the exam going, so you are going to be afterward postgraduate doctor. And after that, this, whatever the message you will carry, your children will carry, your student juniors will carry. And that will be the best thing. And second part of is that, see, I am working in the medical council since last more than 10 years. Sir, the curriculum, you are fortunate because now 2019, total curriculum is going to be amended for the medical college for all subjects, right from ortho, surgeon, everything. So there will be a skill-based now curriculum which is going to be added. It's fine that you are getting this skill-based enhancement here in this workshop, and you are excellent benefited by this workshop. And this is a very good opportunity which has been pioneered by Dr. Joe, and legacy has been carried out by Dr. Kakatkar sir since last more than 6 years back. Last year also I attended his workshop, and I really feel it is now encouraging, because last year, sir, and I was there, it was 175 figure, now it is a 225. Let it be more and more, and the students get benefited. And as a the Vice Chancellor of this whole Maharashtra universities, all medical colleges. It is a definitely, sir, and medical feast for all the students who are working in orthopedics. I once again you congratulate Sir Akatkar sir as well as Dr. Job sir. He has pioneered this, and all of you who are going to benefit for this. And once again I congratulate for this workshop. Thank you very much.
Thank you for the advice. I am sure we all will follow. Finally, I call upon Dr. Nitin Wagh, the HOU of Department of Orthopedics in Dr. Vasantharao Pawar Medical College, to deliver the vote of thanks.
Good morning, everyone. I would like to say thanks from the Dr. Kakatkar, Dr. Job, and Department of Orthopedics Medical College, respected dignitaries on the dais, our Vice Chancellor, Dr. Maisekar sir, Dr. Job, Dr. Kakatkar sir, our Sir Chitnis Madam, Nilimadai Pawar, our Dean Madam, who is always behind us to guide us and to encourage us to conduct academic activities, our renowned national and local faculty, our delegates, and the last but one, our patients who are cooperating us for conducting such educational activities. Once again, thank you everyone for being their presence and spending their valuable time. Thank you very much.